So I'm Kim Roberts, I'm Chief Executive of Henry. Henry's a national charity that has been working over the last 10 years to transform traditional approaches to obesity prevention and make sure that every child has a healthy start in life. I think the key to really turning round the increasing rates of child obesity is to get in early, because we know that it's much more effective to establish healthy habits rather than try and turn round unhealthy ones later on. And the first 1,000 days are a real moment of opportunity to support parents to provide the kind of family lifestyle, home environment, quality of parent-child relationships that are really going to establish those healthy eating and activity habits, those healthy food preferences. So what I was talking about today was the approach that Henry has developed over the last 10 years, which is very much a holistic approach to thinking about looking at the messages from research and thinking about the factors that are associated with child obesity and turning those risk factors into protective factors. So equipping the practitioners, the health practitioners, early years practitioners who are supporting families, equipping the workforce with the skills, the confidence, the knowledge to provide the most effective support they can and really create the conditions for change when they're working with families, and then to really similarly get alongside families and support parents to provide the different elements of a healthy start. And we have a real emphasis on parenting and supporting parents in their role, because it's parents who are the agents of change when it comes to a healthy start for children. And if we can help parents feel more confident to hold boundaries and to provide positive relationships in the family, then they're much more likely to be able to establish healthy routines. One of the examples I shared today was our work in Leeds as a case study of effective local partnership. So Henry's been embedded as part of the citywide child healthy weight strategy for the last 7 years. And in that time, all health visitors, every children's centre worker has been Henry trained, and that's over 1,200 staff. We're now training the childcare workforce. We've got staff trained to deliver the Henry Healthy Families programme, either in a group or one-to-one in children's centres. So it's a really sustained, holistic approach to tackling child obesity. And what we've seen in that time is child obesity rates at reception drop from 10.3% when we first started working in the city to 8.5% at age 5 now. And in the most deprived areas of the city, that drop has been even more acute. So what it means is that in Leeds, that health equalities gap, or the inequalities gap of obesity rates at age 5, is actually narrowing, whereas in other areas of the country, it's either widening or just maintaining. I think it's been a great day. I think it's been one of those days where people have really challenged us all to continue to think big and to work creatively together and with local communities to find new solutions to some of the public health challenges that face us.